Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and good afternoon, everyone. We were not here yesterday, so I want to acknowledge the death that was reported from Northwood yesterday. And as we prepare for a weekend, there's a family in Nova Scotia who's mourning the loss of a loved one. And on behalf of all of us, I want to extend to them our deepest sympathies and condolences on their loss and let them know that we as Nova Scotians are with them as they mourn. And I'll turn it over now to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And again, I also share my condolences with the family of the latest person to unfortunately pass away at Northwood. We now have 58 Nova Scotians who have died due to COVID-19. Again, a reminder of the potential serious nature of this disease. Today, I'm reporting we have 2 new cases of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 1,048. Both of these new cases are related to Northwood, one a resident and one a staff member. So we continue to have no cases now for the last few days that are related to or that are outside of Northwood, which is continuing good news. The QE2 lab processed 427 tests yesterday. We currently have 8 people in hospital, 4 of those in intensive care. 961 people can be considered recovered. We now have had 37,405 Nova Scotians who have tested positive and had negative results. We remain with two licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. One is Northwood with 16 residents and 4 staff, and the other facility has a single resident who is still considered an active case. So as you can see, overall, our epidemiology is headed in the right direction. The number of new cases continues to remain low, and the vast majority of those are related to the Northwood outbreak. And so that's very pleasing to see. I've been talking a lot with a lot of different groups or in consultations in the last couple of weeks, and I can keep using the phrase new normal, and I think that's a phrase we're going to all have to get used to. As we would come out of the first wave of COVID-19, it's not about going back to where we were in 2019. This is about a new normal living with COVID. That as we come out of the first wave, and we're talking more and more about how we recover. It is about the new normal, which is living. Things need to maintain. Some things need to be maintained that allow us to live with COVID in a reasonable and balanced way. We have done reasonably well through the first wave. It has certainly had substantive impacts, but I think overall we've been able to limit the impact directly from COVID, and we can all be proud of our ongoing collective efforts. But again, this isn't over. We are likely to see, even as we're coming out of first wave, we have to understand that we are likely to see a second wave sometime later on this year in the fall or winter. Nobody can be definitive about that. Any of the reasonable experts would say we're likely to see a second wave, but not exactly sure when and not exactly sure how severe it would be. So, but even between now and any possible second wave, as we continue to work now to reopen our society in a way that finds the necessary and appropriate balance by continuing to have an important level of control over COVID-19, while at the same time reopening our economy, reopening our society, but also in a way that finding that balance is what creates our new normal. There are some things that are going to have to remain in place for a long period of time that allows us to find that appropriate balance. That those are the tools we have to continue to control COVID. Many of them are ultimately about what we do as individuals and what we do or don't do. And then the recovery is all about building environments, whether it's a business environment, retail environment, any sort of community environment that has an appropriate level of safety, that by supporting many of those individual behaviors, such as good hand washing, making sure we can physical distance when at all possible, possible. Limiting non-essential travel, certainly people staying home whenever we can when we're unwell, and building support so that people can do that. Limiting large groups of people getting together, especially indoors, and finding if certainly people wearing non-medical masks in certain situations, especially when there are people are getting together and they can't respect social distancing. That's certainly something at this point we would like Nova Scotians to certainly consider that. While we want all our COVID numbers to stay low, it's also vitally important as we move into this recovery time that we continue to be vigilant, have a strong surveillance, and that we need to make every reasonable effort that we can to identify every single case of COVID-19. To that end, today we're announcing that we're expanding the list of symptoms that we're using to screen people for COVID-19 testing. This is based on national conversations. We've learned over the last few months that the COVID-19 actually can present in a more diverse way, a greater number of symptoms than we originally understood at the beginning of the first wave. All other provinces are adopting the same broader list of symptoms for the same purpose of making sure we have a very low threshold for identifying, testing somebody who may have COVID-19. So beginning today, if you have any one of the following symptoms, we're asking people to contact 811 to go through the online assessment, if possible. If not, calling 811, and then you'll get further direction. So anybody with any one of having a fever or having chills or sweats, a new or worsening cough, sore throat, headache, shortness of breath, muscle aches, sneezing, congestion or runny nose, hoarse voice, having diarrhea, unusually tired, unusual fatigue, a loss of sense of smell or taste, and red, purple, or bluish areas on the feet, toes, or fingers that aren't there without a clear explanation. I know that's a long list. That this information is all on our coronavirus website as well. But any of those symptoms, we want people to call and do a further assessment. I have to emphasize, though, that all of these or many of these are very common symptoms, and just because you have one of those, I don't want to create undue stress. In all likelihood, if you have these symptoms, it's not because of COVID, but it's very important that we test you to rule out COVID. It remains critically important. Our recovery, it needs to be informed by very good active surveillance. It's far better that we test large numbers of people, having lots of people be negative, better being safe than sorry. But it's also important that if we do have a positive test, that was somebody that we otherwise didn't recognize. And that's very important for us to know that. So again, there's a large number of symptoms. Many of them are common. It's important that if you have them, get tested, but I don't want people to get all stressed and anxious just because we're asking them for a COVID test. It's just an important part of our active surveillance and having a very low threshold for testing people to rule out COVID. And again, you can access the usual ways remain. We've worked with 811 and our assessment centers. They're well aware of this. They're prepared for any increased volume of calls to 811, any increased volume of testing. I was hearing earlier today that we're already seeing more calls, and that's exactly what we were expecting and what we want. More people calling with common symptoms, making sure we test them when appropriate, as really important part of our active surveillance at this point in our recovery stage. I also want to touch on one other topic, which is keep getting lots of questions on, which is the use of gloves in a non-medical setting. It's important to understand that a very strong recommendation across the country from public health that we do not encourage the use of gloves. It's important that we see a lot of people, and what gloves do is give people a false sense of security, and they're much less likely to wash their hands. The virus gets on gloves just like it gets onto your hands, but because you're wearing gloves, people are much less likely to actually do the appropriate and thorough washing. So it's important that people rely on good, frequent hand washing as the way to keep their hands clean, not on wearing gloves. And especially if you think that you're going to be out and about touching a bunch of surfaces, picking up objects as you're out in public, and that you want to protect yourself by wearing gloves, I would say don't wear gloves. Make sure that you can wash your hands frequently as you're doing that, and certainly before you go back to your car or before you go back home, making sure you have some hand sanitizer, washing your hands carefully. But please, we are strongly discouraging the use of gloves. I hope with the loosening of restrictions over the last couple of steps we've made that people are starting to feel some normalcy returning to their lives. It's important that people continue to reconnect with your community, get outdoors and be active, but to do doing it safely. It's quite warm and muggy out there today, and I know I'm hearing lots of reports where people are headed to parks, trails, and beaches with the weekend ahead of us, and we really are all need to have some warmer weather ahead of us. But please ask people. It's important that you remember that no matter where you are, that it's important to continue to practice the physical distancing. If you do it's important if you drive to a park or a trailhead or a beach, that even though there are maybe other cars parked there, keep social distancing when you're in the parking lot, as you're walking to the beach or getting onto the trail, going into the park. Groups if you're in the same household or a bubble household, can be together, but make sure you're separated at least 6 feet from other household or bubble household groups. And again, continuing to practice all the other measures of good frequent hand washing, avoiding non-essential travel, staying as much as you can, doing those activities within your community. If you are feeling unwell in any way, we ask you to stay home. And if any of the symptoms if you're not sure, just go and do the 811 online assessment tool, and considering wearing non-medical masks, especially when you're out and about in public and you can't be assured of keeping that physical distance. So I wish everybody a safe weekend. Get outdoors and get some fresh air, but continue to do things safely. Continue to look after each other. Practice everything we need to do with care and compassion and building a positive sense of community. Have a good weekend. Premier.
Thank you, Dr. Strang, and Tina will be happy to answer any of the questions.
Just a reminder, we'll take one question and one follow-up from reporters on the phone in the allotted time that we have. For those of you on the phone lines, please ensure that your phones are on mute. I'm hearing that someone is not on mute. We will start with Alicia Drouse from Global. Go ahead, Alicia.
Thank you. This question is for the Premier. Yesterday you said that it's been made clear that Nova Scotia is not taking a phased approach and that all the businesses will be opening at once when it's determined that they can. But given that there's still many restrictions, including on borders and group gatherings, it seems like many things still won't be allowed, like conferences, concerts, weddings, and travel. So if we don't have a phased approach, I'm just wondering if and when Nova Scotians will get to see some sort of plan on when further restrictions could be eased.
So I appreciate the question. What we have said for the businesses that we've closed down, as we continue to see the flattening of the curve, continue to see COVID eliminated from community spread, we'll provide protocols to all of the associations that represent those businesses. We're seeing now, we've done it with cosmetology, for example, that information is being shared with salons across the province, and they'll be ready when we lift the restrictions. As we continue, there will be always the restrictions on the size of capacity in restaurants, for example, or the number of people in a particular area, and those would change over time. But in terms of the economic ability of a business to start, they will be happening together. We're actually seeing some of the ones that we haven't closed who had chosen to close actually are reopening now following the public health protocols.
Go ahead, Alicia, with your follow-up.
Thank you. I just want a little bit more clarity. Again, I understand that all the businesses are expected to at least be allowed to open at the same time once you have properly consulted with everyone. But for everything outside of businesses, so things like that group gathering limit and maybe even like recreational sports and, again, the border and travel, I'm just wondering, not asking you to commit to dates, but I'm just wondering if there's any kind of benchmark or plan for when we might start to see some of those restrictions eased and what Nova Scotians can expect out of that.
So we're still in consultation right now with Sport Nova Scotia, for example. Is there a way that we can have local day camps at home in our respective communities across the province? I think Dr. Strang has been really clear. Week-long camps where people are staying won't be happening this year. Looking at probably competitive sports will be more challenging. What we're really looking at is how do we do day camps, so working with and providing the proper protocols. So that will still be ongoing. You will see looking at what group sizes will be determined by public health as we go forward, those social gatherings, if you will. And I think that's an important clarification on a social gathering as opposed to a large facility where people are working, keeping the public health protocols 6 feet, all of the things, lots of hand washing. That activity will be able to continue. And as far as the border, we'll continue to hold our information pickets at the border and all our entry points until further notice, and we'll work with public health, particularly when we need to lift that self-isolation, all those types of things.
Next, we'll go to Frank Campbell from the Chronicle Herald. Frank, go ahead. Frank, I'll come back to you. We'll go to Natasha Pace from CTV. Natasha, you there?
Yeah, I'm here. What's up?
Frank, is that you?
Yeah.
All right, go ahead, Frank Campbell.
Okay, sorry. So the Funeral Association has called for the province to relax restrictions on mourners gathering in cemeteries for committal services. The association says there's no practical difference between gathering in a park and gathering in a cemetery, and that it's time for families to be allowed to attend the gravesides of their loved ones. When might these restrictions be lifted?
Certainly, I'm aware of that correspondence from the Funeral Association. Certainly, that's one of the things we're looking at to bring forward as part of our first step in the recovery is what are the numbers and the types of settings, and we're looking at whether it's pure social gatherings versus important cultural ceremonial things like funerals. We have faith services. We have sport, recreation, cultural events. We need to look at all of those and how do we actually allow them to continue, but expand perhaps the numbers and the ways they're able to do things. And so we're actively looking at as part of bringing that forward for consideration in over the next number of days and weeks as part of the first step in the recovery plan.
Go ahead with your follow-up question, Frank.
Okay, thank you. You may have touched on this one, but the follow-up would be, is the province considering relaxing numbers for gatherings so people can congregate in some way at their places of worship?
So again, that's part of that. What is the type? There's a number where people get together for a number of different purposes. We closed everything down very tightly, but now as we open it up, we have to understand that there's a greater diversity as we open things up, and what are the rules around all of those that facilitates an appropriate number of people that can get together. And so we're looking at all of that.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, you said that this expanded symptom list is being adopted by all provinces and territories and is based on our growing knowledge of how COVID can present. Can you explain what that means, what our growing knowledge of COVID can present? Like, what has changed?
So at the very beginning, we used fever and cough. Because that was our understanding of how it typically presented. Now we've had thousands of cases in Canada, as well as many more around the world. The medical understanding of how COVID can present, it's not just with fever and cough, and that's why as for a number of weeks we've had fever, new cough, as well as headache, runny nose, sore throat, because that was often those are the major symptoms. We track all this even in Nova Scotia, but we're also seeing that all these other types of symptoms are presenting common ways they present in Nova Scotia, and as we share information around the country. So it's simply a reflection of our medical knowledge around this virus and the type of conditions it creates and how people present has continued to grow as we get more experience and more knowledge with the virus. It also, so that we're adopting the list because we want to make sure we don't miss anybody. And so having this very broad list is important at this time. The likelihood of anybody with those symptoms of having COVID right now, we know Nova Scotia is low, but it's very important that we get them in, get them tested, and then we can say, you don't have COVID, you may have something else, and then they get the ongoing medical attention for whatever else it might be as necessary and appropriate.
Go ahead, Natasha, with your follow-up.
Thank you. Having expanded the list, how can you keep up with testing, and will there be adequate supplies of testing kits and other supplies needed, like PPE?
So we're very comfortable. So we before we even did this, we've been working on this for a week or more with 811 to make sure, and they're very comfortable with their capacity. We're working with the Nova Scotia Health Authority and our assessment centers, and they're comfortable with the process there, even if we see an increased demand. And then lastly, with our labs, we still have the ability to do upwards of 1,500 tests a day if necessary. Right now, we're doing 400 to 500 a day. So we have lots of in all these areas, because COVID has decreased, we're no longer in flu season, we're having a lot fewer people coming in, and so we have lots of capacity in the existing infrastructure, if you will, that we've built in the healthcare system for testing people with COVID, and it's a key piece of we need to maintain that infrastructure and use that as appropriately to make sure we have a very broad range of testing, and the first step in doing this is greatly expanding this symptom list.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Thanks. Dr. Strang, to what degree was the decision to expand this list of symptoms that would qualify for testing based on the looming reopening of society and efforts to try to test as broadly as possible as people start going back out and interacting with people more regularly?
So it goes hand in hand. As we reopen, as you've heard me say many times, that how we monitor, the ability to closely monitor the impact and of COVID-19 transmission by opening up society and the economy is critically important. It's a fundamental piece that needs to be in place. So the timing of the expanded symptom list fits very nicely with as we're moving into the recovery, that we have a very aggressive, active surveillance system based on a very broad range of symptoms. Again, knowing that most of those aren't people with COVID, but we want to test a lot of people based on all these symptoms, knowing that many of them will be negative. That's exactly what we want to see. But having this kind of active surveillance is critically important to continue the ongoing monitoring as we move through the coming weeks and months on the recovery plan.
Go ahead, Mike, with your follow-up.
Dr. Strang, in the past, when you talked about the criteria necessary for someone to be tested, one of the concerns that you had voiced was the potential for inaccurate test results. And now that you're not only expanding the list, but you're actually telling people if you have one of these, it's no longer even a requirement that they have two or more. Do you have any concerns about the reliability of the test results that will come from these?
When we've talked with a lab and our lab specialists about this extensively, both here in the province and as part of our national conversations, when I've said the test becomes unreliable is when you start testing large numbers of people who have no symptoms whatsoever. And so the probability of them with no symptoms becomes even less, or the chance of them having COVID-19 becomes even less than even if they have one of the symptoms on the list. So the lower the probability of having COVID-19 before we even test you makes the test less accurate. So the test will perform well even with this expanded symptom list. It performs it's much less effective and accurate if we broadly test large numbers of people with no symptoms whatsoever.
Next, we'll go to Mike McDonald from the Canadian Press. Go ahead, Mike.
Hi, good afternoon. My question has to do with this new list. I'm not sure if I heard it correctly, but I believe that one of the symptoms is fatigue, tiredness, And I'm going to submit that that's going to take in a lot of people, given the fact that we're all pretty tired of having to deal with this pandemic. What are you going to do at the 811 level to make sure that the system is not overwhelmed by people calling in and saying, I'm tired, I need to be tested?
So if the language is extreme or unusual fatigue. So there is some interpretation in that. Yes, there may be some people, but we're well aware of the possibility of how this gets interpreted. We will continue to monitor the impact on 811 and our testing, and we're not going to be doing this forever. We're doing this for a period of time, and it's important that we do this right now. As I said, the timing is good, but it doesn't mean we're going to have this same list for forever and ever. We'll continue to adapt that list as we get further knowledge of COVID, as we understand our epidemiology. But again, I want to emphasize, it's not, I'm tired every day, but I'm not complaining, but it's unusual or extreme fatigue, which is what we're looking for as a sign of COVID. So it's something that's very different than the normal fatigue that many of us have.
Go ahead with your follow-up, Mike.
And Dr. Strang, again, I have to assume that that is something that you will try to pin down with 811. What will people be asked to make sure that they have that unusual tiredness and not just general fatigue?
But that's our language. So for the public, the language in the list, it says extreme or unusual fatigue. Yeah, people have to interpret that, and there are going to be some people who phone in because they're tired. And you know what? That's okay. We have good capacity in our system to deal with that. We'll continue to monitor the impact as well as what the types of results that we're getting from this over the coming weeks.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Dr. Strang, day and short surgeries will resume on Monday. We've heard from people who require surgery with more substantial hospital stays that are concerned and waiting in pain. Today we have just 8 coronavirus hospitalizations. When will more healthcare services and surgeries resume?
So there is an active plan. Like everything, we need to start somewhere and continue to expand on that. The logical place to start is with day and short stay surgeries, and in the coming weeks, I know the active planning in the healthcare system about how do we continue to expand and have a more extensive, over time, a more extensive return of services within our hospitals. We're also part of our consultation is I've had discussions in the last couple of days with both regulated and non-regulated healthcare providers. So all of our community-based healthcare providers, we're looking to get them back in direct. Many of them can do virtual care, but also doing face-to-face care as well as the community-based care along with our hospital care. So we're starting with we have to start somewhere, knowing that there's lots of needs that we have to try to move and address those needs. At the same time, we have to understand we always have to make sure that we're keeping some capacity in our healthcare system. So if we get a sudden surge of COVID-19 and we have hospitalizations, we have the ability to deal with that in our healthcare system. So like everything else, I keep talking about, this is moving forward, finding the appropriate balance of keeping an eye on COVID, doing the right things for COVID, but reopening up everything, including our healthcare system, acknowledging that we can't open up everything in the healthcare all at one time, and appreciating that there are people with urgent needs, but believe me, everybody in the healthcare system, from the CEOs on down, are well aware of that and are doing what they can in a timely manner, but also in a very planned manner.
Go ahead with your follow-up, Lindsay.
Thank you. Premier, you've repeated that we won't have a phased reopening plan. Why have you chosen this approach instead of organizing businesses reopening in phases based on low to high risk, as other provinces have done? And why is this different from what Dr. Strang presented us with a couple weeks back?
Well, it isn't what we have said. We'll be talking to the associations. We're doing a lot of work right now, preparing businesses to start. It's not lost on me that the economic impact has happened to entrepreneurs across Nova Scotia from one sector to another. I don't think it's appropriate for me to say this sector should open or that sector should open 2 weeks later if they've done their work and they've met the protocols of public health. Why should I decide that? They're investing their own money. When we see that the curve is flattened and that the economy is going to open up, let's not pick winners or losers. Let's make sure that everyone is following public health protocol. That's the work that Dr. Strang and Minister McCollum is doing right now with associations. I fully understand the impact on families, the incomes of these businesses, and we're doing the work to flatten the curve and prepare them to start as quickly as possible.
Next, we'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thanks, Tina. Dr. Strang, I really hate to keep harping on the statistics that the province releases every day, but there's still timing issues. So where the statistics related to what's happening in long-term care are still being updated a day later than other statistics. But it's my understanding that you had done something to fix this last week. Can you clarify what's still happening there?
So we're making sure that what we report is there was what was the issue last week was we had a backlog of individuals that hadn't been followed up to move them from they were still considered active, where the reality was they actually could be moved into the recovered phase. We had a large group of those, and public health did that a day ahead of what was done in the long-term care facility, and so there was a day of some discrepancy, and we've resolved all that. We still have, because we have a long-term care information that's collected, and then public health collects information on the other cases, and we use our public health information system. So we still have that day difference. It's just we're using two information systems. That's the reality of a world in health and in healthcare where we have multiple information systems. But the discrepancy, the timing discrepancy, is still there. But the other discrepancy around large numbers of people moving them from active to recovered has been resolved.
Go ahead with your follow-up, Kyle.
Okay, Tina. I got you there, Dr. Strang. So let's talk dreams. What would it take to get all those systems or all those statistics more current? I suggest that this is a pretty good thing for a government to invest money on, to figure out exactly where we stand today. So, would it take an extra data entry worker? Is it a whole new system, or some way, a team of workers to bring those systems together?
So data and information is very complex in the healthcare system. We have a project, a long-term project that would bring on the one patient, one record. You've heard the department, the Minister of Health and Wellness talk about that. It's a lot. We have multiple data in multiple places in different systems. That's very complex. But the long-term objective is to create a single kind of cohesive approach to data and information in the healthcare system. There aren't quick and easy fixes here, as much as people may think it should be. This is a complex world. I'm not an informatician or a data person, but when I've sat at meetings on this, it is very big and complex.
Next, we'll go to Bill Martin from Six Rivers News and Radio.
Thank you. I have a question for the Premier. Mr. Premier, I asked this question of the doctor recently from the public health perspective. I'd like to ask you now from a political perspective, and it is this, that in recent years, the policy of the province has been to support Halifax with the view that if Halifax prospers, Nova Scotia prospers. Well, now we have a situation where rural Nova Scotia has been hurt by such a policy, with an exodus of young people and entrepreneurs. We now have a situation where the epidemiology suggests that the difficulty remains in Halifax, not in rural Nova Scotia. Would you consider some fashion to open things up sooner in the areas where the curve is very flat?
Well, the premise of your question is not accurate. The fact of the matter is there hasn't been a focus solely on Metro. There's no question we should be proud of our capital city and the growth that we've seen here. I'm just as proud, though, quite frankly, of the export growth that we've had in seafood and agri-food, and the amount of volume and increase in price that is listed. All of that's been spun around in rural communities from one end of this province to the other. 10 of our 18 counties have had growth in population through immigration. Population has hit an all-time high. That growth has not just been in Halifax, it's been across the province. So the idea that there's been some focus solely on Halifax is just not the case. The fact of the matter is rural Nova Scotia has been growing, and so has its capacity to retain young people. We in the last 3 years retained more young people than we've lost. That's the first time that's happened since I think John Buchanan was the premier the last time that would have taken place. The focus on a diverse plan for our economy is not only benefiting Halifax, it's benefiting rural Nova Scotia. But one of the things that I will never get into, it's a false debate, dividing our province up. We're a population of less than 1 million people. We're on our march to 1 million. But we need every part of our province to continue to grow, and it is. And the last thing we need to do is turn our sights at one another. We're a province that can look out into the world, not just take our place inside of the Federation of Canada, but quite frankly, I'm proud of the fact that our government and this province has stood on the world stage to ensure that our world-class products have gotten the value they deserve, and the entrepreneurs in this province got the return on their investment.
Go ahead with your follow-up, Bill.
Premier, I appreciate your passion for the growth in the province, but the fact of the matter is there are some counties in particular that have suffered loss of population and loss of other things that now bear a greater burden. And if those populations right now have a flat COVID curve, giving them a little bit of a leg up might be, at least politically speaking, might be advantageous.
Well, I've never made a decision in this job for political reasons. I've always made a decision what I believed was right for Nova Scotians, and the politics would figure their way out. And Nova Scotians will make their decision on whether I should return as their government. They get a chance to do that. So I will never make a decision for political reasons. And I want to reaffirm this position. 10 of our 18 counties have grown. We've seen more young people choosing to live and work and play in this province. More of the global community is choosing to come and live in Nova Scotia. Not all in Halifax. Some are. And we should be proud of the fact that our capital city is seen as by an international airport, a world-class port that we have. We are connecting through CN to the global North America supply chain. We've seen our seafood product that has gone global. We've seen tremendous growth in investment coming in, and it is not. And I think it's important that we do not divide our province. These are challenging times. There's no question about it. I live in rural Nova Scotia. I live in Annapolis County. It's faced its challenges for sure. But I'm not going to complain about the fact that Halifax has grown or that Kings County continues to grow. I have 2 children, and I use this example many times. One of them worked out west, and one of them had a job in this city. Which one of those do you think I saw more of? So why would I complain about one part of our province doing well? Let's just figure out that what we can do in our communities continue to grow. And I'm proud of the growth that Nova Scotians have been doing over the last 6 years, not only to fix this economy and not only to find our place in the Federation, but quite frankly to send a message to Canada and the world that we're open for business and that we can compete on the global stage, and that we will continue once we deal with COVID, as every global community is doing. We will continue then to set our sights on an export opportunity, welcoming new citizens to this community, making sure that we have economic opportunities in every part of this province, and we'll do so by staying united and focused on one Nova Scotian, one that includes us all.
That's all the time we have for questions. Go ahead, Premier.
Thank you, Tina. Dr. Strang has completed another week of consultation with business and associations, and he and I agree it's going well. These consultations are with those companies who were ordered to close, now that they have the information they need, and many are getting ready to reopen. Salons, for example, have been given new rules, and they're figuring it out. The shop may look a little different the next time you're in for a haircut. The stylist may be wearing a mask, but you will be able to get your haircut soon. For those who were not ordered to close, but chose to anyway, you can open any time, as long as you have a plan that complies with public health guidelines. Make sure your workplace, employees, and customers are safe. Distance yourself, wear a mask where necessary, sanitize your workspace regularly, and practice good hygiene. I've noticed a number of small businesses coming back already, and they're doing it right. Thank you for that, and welcome back. Many businesses stayed open when COVID arrived, our pharmacies and our grocery stores. Didn't take them long to figure out how to adapt to the new protocols. Plexiglass at the checkouts, arrows directing one-way aisles, stickers on the floor 6 feet apart, and sanitizing between customers. You're an excellent example of how to do it right. Dr. Strang will continue his consultation, Minister McClellan and his team will complete the follow-up. And as we get closer to an official reopening for those who are order closed, and I want to say to you, I know this has been difficult, as I've said many times. It's why we will not do a phased-in approach and leave some of you behind, as others will be allowed to open. We will welcome this economy and open it due to public health protocols at the same time. No one could have ever predicted that we would be shut down for more than 2 months, but stay strong. We are feeling good about where we are, and we're getting ready. I have confidence in your ability to operate under these new conditions, and that's why I think we'll be ready by early June. As long as we continue to follow the protocols, do what public health is telling us, we keep flattening the curve and work together. Have a nice weekend, be safe, but be smart.